Welcome back to another episode of Health Insurance Unraveled. My name is Travis Dahlman. I'm a licensed health insurance broker. I'm based out of Clintonville, Wisconsin. I service mostly central Wisconsin, northeast Wisconsin, as well as some outer regions of Wisconsin as well. If you are outside the state of Wisconsin, you have any insurance questions as we go along here, always feel free to reach out. I have colleagues all across the country, as well as I am licensed in multiple states. However, I do specifically focus and specialize in those policies based in Wisconsin, since that is where I am currently located. So today's topic, we are going to cover Medicare by the numbers for 2023. What changed from 2022 for Medicare recipients heading into this new year? We're about a week and a half into the year, and there have been some monumental changes from Medicare from last year to this year. So let's get started. The first thing I want to cover here is the Medicare Part A deductible. In 2022, that deductible was $1,566. In 2023, that did go up to $1,600. So that did increase a little bit, which means that you're going to pay a little bit more if you just have Part A and Part B with no secondary policy, or if you just have Part A by itself and you go to the hospital, you're going to have to meet a little bit more of a deductible this year than you would last year. If you have some type of secondary coverage, whether that be an advantage policy or a supplement policy, typically those policies help alleviate that Part A deductible. But if you do just have Part A, be aware this year that deductible is $1,600. As far as one of the best things to happen to Medicare recipients in some time, that Part B premium did go down in 2023. Last year in 2022, the average Part B premium was $170.10 a month. Everybody's is a little bit different, but that's the overall average. In 2023, that Part B premium did come down to $164.90. So what that means is, however you pay that Part B premium, a lot of people have it deducted right out of their Social Security checks. And those who don't receive Social Security yet and get Medicare, checking account, savings account, debit card, credit card, send in coupon books, however you do it, however you pay that Part B premium, that did come down for the majority of individuals in 2023. Average for that Part B premium, once again, $164.90. There are some secondary policies out there, specifically in the state of Wisconsin, I do just want to make you aware of quick, that do help reduce down that Part B premium even more. If you receive TRICARE VA military benefits, feel free to reach out to myself, your Medicare broker, anybody you trust with your health insurance information, because there are policies out there that help reduce down that Part B premium even more. If you do receive TRICARE VA military benefits, or if you don't need a prescription drug policy. As well as if you do need a prescription drug policy, there is a plan out there that helps reduce down that Part B premium in some service areas by $25 or so every single month. So there are ways to even bring that down a little bit more. We'll touch that in a later video series. If you ever have any specific questions, reach out to myself, your local broker, whoever it is you trust with your health insurance. The next thing we're going to cover is that Part B deductible, B as in boy, or medical Part B. Medical Part B deductible in 2022 was $233. In 2023, it is $226. What that means for you is, if specifically, if you have Plan G, which is a Medicare supplement policy, you typically have to meet that Part B deductible before the insurance starts paying their portion. So this year you pay a little bit less than you would have paid last year. Most you're going to be charged for that Part B deductible is $226. If you have a policy, if you have Plan F, if you have, if you're grandfathered into one of those older supplements and they cover that Part B deductible, or if you have an Advantage policy and that policy covers that deductible, that's something you don't have to worry about. But for those individuals who do have, say, Plan G, which is a very common Medicare supplement policy out there, your Part B deductible this year, $226 is what you'll have to meet out of pocket before the insurance starts paying their portion. The big change here for prescription drugs, that did increase from 2022 into 2023 for your deductible. The deductible, once again, is not a copayment. It is the amount you have to pay out of pocket before the insurance starts paying their portion. In 2022, the Part D for drug deductible was $480. That means the most you could have been billed for a deductible for a prescription drug policy in 2022 was $480. In 2023, that is capped at $505. So that did go up quite a bit. If you do have a standalone drug policy and you are on a policy that has a capped drug deductible of $505 in 2023, explore other drug policies in your service area. There might be something that helps reduce down that deductible a little bit. You might have a special election period, open enrollment still going on. So there's different ways to potentially get to a policy that helps alleviate that out-of-pocket cost up front for you. If you're on an Advantage policy and that policy has a drug deductible that's capped at $505, you can potentially explore other policies at this point during the open enrollment period as well. We'll explore that down the road in a later video series. But once again, the Part D for drug prescription deductible, most you can be charged for a deductible, which is the amount you pay before the insurance starts paying their portion in 2023, is $505. The next series of numbers I'm going to go through is in regards to what happens once you meet that deductible, whether it be $0 or that 505, whatever your policy is. At that point, you typically have some type of copay or co-insurance. You pay a portion. The insurance company pays the other portion of those prescription medications. Well, the one big question I keep getting is the donut hole when it comes to prescription medications. The actual term for the donut hole is called the coverage gap. In 2023, that coverage gap did get increased to $4,660. That is good news for you if you are taking some of those higher tier medications. It basically means, hey, your insurance policy is going to cover those medications a little bit longer before you hit that coverage gap. So if you ever hit that coverage gap of $4,660, you take the total amount of the medication, so the amount that you pay plus the amount that the insurance company pays, add that together, you get the total price of the medication. Once that total price of the medication throughout the course of the year gets to the point of $4,660, you enter the coverage gap, otherwise known as the donut hole, and at that point you pay a co-insurance or a co-percentage up until the time that you hit the catastrophic coverage stage, which this year went up to $7,400. So if you do ever hit that $7,400 during the catastrophic coverage stage, then you pay a reduced down co-insurance or a set co-pay, depending upon the policy you have. There are some policies out there that do offer exceptions during the coverage gap, otherwise known as the donut hole. So if you do have a specific question about a medication, reach out to myself, your broker, your insurance customer service, and they should be able to let you know if your policy does offer some type of protection for certain medications during the coverage gap. If you do receive any type of extra help, the extra help for low income subsidy in 2023 has changed as well. The extra help for low income subsidy level 1, that did increase, which means that you're going to pay a little bit more for your medications if you're receiving that this year. LIS level 1, $4.15 is the most you're going to pay for a generic medication covered by your policy. Brand name medications, $10.35. That's the most you're going to pay for a brand name medication that's covered by your plan. Once again, if you do receive LIS level 1. LIS level 2 levels, $1.45 is the most you're going to pay for a generic medication, $4.30 for brand name medications covered by your policy. There have been some changes overall to medication costs. One of the big ones is shingles vaccinations. Those are now a $0 copay for you across the board, as long as they're covered by your prescription drug policy, as well as with the insulin reduction. Most insulins now are a $35 copay cap. Some of those policies out there do help reduce down that even more. Check with your current broker, agent, reach out to myself, customer service team, if you want to explore what exactly your cost for certain medications may be based upon the policy you do have. As far as LIS level 3, there is no change to that for this year. If you do receive low income subsidy level 3, otherwise known as extra help, you will pay $0 for your medications, generic and brand names that are covered by your policy. Every week, I plan on releasing a new video. My name is Travis Dahlman. This has been Health Insurance Unraveled. If you have any questions, please feel free to reach out. As we go through this series, I will deep dive into the differences between the catastrophic coverage stage as well as the coverage gap to explain that in a little bit more detail for you. We're going to start 2023 on a high level, and as we get through, we'll dive a little bit deeper. Thank you for watching.